Tucker, thank you so much for walking us through that. I don't know how everyone else feels, but I know I needed it. I feel much more just grounded and here with you all, which is exactly what I was hoping for. I hope you all feel it too. This is a stressful time, an uncertain time, and it's important that we take care of ourselves and each other. So, Tucker, thank you so much for doing that. We appreciate you. I am going to pop up my screen again. And first, just want to cover, what our focus will be while we're here together this evening. Um, I will share a little bit about the behavioral health roadmap implementation, just sharing an update with you all. I will also first, though, cover some background because we do have some new faces here this evening. I'm so excited about that. We want to make sure just to share some context with people who haven't participated in the roadmap process or who may not be familiar with it. I have just maybe 5 slides, though. The true focus of this evening is to spotlight some of our key partners who are here this evening. We know that there are struggles with accessing mental health resources in our community. There are limited ability for us to provide new resources right now, but we want to make sure our community knows how to access what's available. So we'll be spotlighting 3 of the different programs that exist so that we can help get the word out and help get people connected to the care that they need. And then we'll briefly at the end just talk about what's next. Before we dive in, though, I want to take just a moment to share some gratitude. Gratitude for everyone who is here this evening, spending your time with us. Looks like we have over 70 people here. That just means so much. And I think it says a lot about how much we care about this topic. I also want to thank all of you who participated in the roadmap journey and getting here and all of the time that you've invested in that. And that includes the prior behavioral health planning team. I want to share some gratitude for them and the work that they did to help us get to today and to this point where we're actually implementing this vision that our community has come up with. So, thank you to Marcy Campbell and Lisa Moreno and Tucker Yearman, who we're so grateful that you're
Tucker,
still here in your
gracias.
new
Estamos muy
capacity,
agradecidos de que estás
as well
aquí.
as Madison Clinchard. So I just
Y
wanted to make sure to take time to recognize all of you and your efforts and everything that's gone into this. Now, like I said, I will share some background on the roadmap for the folks who are new here and may not be so familiar with it. And while I'm sharing that with them, for those of you who are familiar with the roadmap and have participated, I'd like to ask you, what goal from the roadmap really stood out to you or seemed most important to you? So if you could be thinking about that while I share these next 2 slides, um, pop your answers into the chat and Morrison will help walk us through the responses there. So to share a little bit of background on the Behavioral Health Roadmap and what it is for those of you who are less familiar, this group was formed over a couple of years ago in 2022. Our community came together to say we recognize that there are challenges with people accessing the help that they need when it comes to mental and behavioral health. And, the system that we have right now lives in many places. Hopefully you can see my cursor over in these 2 left batches of arrows where it's very fragmented and siloed, and many of the different agencies and partners are kind of doing their own work and not necessarily together. In this second batch of arrows, there is quite a bit of individual impact that's happening, but where our community would like to see us go is to a place that we're able to do coordination and collaboration together. So out of those challenges, from being really siloed in our work and having a hard time with coordination, it's so hard for people, for individuals to navigate the services that are out there. It creates barriers to care, among other barriers and just a lack of comprehensive services. The community said we need to come up with a plan to do things differently. So our goal is to move more towards alignment and coordination together. At the time in 2022, there were changes that were happening. There was funding coming from the federal government. The state government here in Colorado was going through its own reform of how they address mental and behavioral health. So it really was a key time. And our community came together to say, let's talk, let's come up with a plan. And there were somewhere between 600 and 700 different people who came together to share their vision. And ultimately, what it ended up being was a reimagining of how we address mental health and substance use in our community. So that really was the catalyst to get us there. And they came up with the plans. So I am not going to go into all of the details this evening, but I wanted to show this slide so that you could see, they're part of the vision. There were two key vision points that our community really zeroed in on, which is we need to make sure that all community members can get the right care at the right time. And we need to do it as we create a community of belonging. As part of all of this, we established our guiding principles. We came up with 6 primary goals with many strategies that go with those goals to get us there. And then also a trusted system criteria, a set of criteria to hold us accountable to this work. So, like I said, I really wanted to give just a very brief, high-level overview of what the roadmap is. You can see the URL in the bottom right. Morrison will drop it into the chat as well. If any of you have questions, you want to learn more about what is in the roadmap, talk about any of it, please, you're welcome to visit the website, but you're also welcome to reach out to me. Morrison will put my email address in the chat too, so please feel free to reach out. So with that, I just want to share a quick update on what's been happening this past year as we've moved from that huge, imaginative phase and visionary phase into actual implementation. So this year, where we started working, we hired and onboarded staff, and mainly that means myself. So as the behavioral health system manager, I was brought on around the 1st of March. We have Morrison Donovan, who you all met earlier, who is our program support specialist. She joined us over the summer and then full-time at the end of August. We have a couple of other key team members who are going to be playing a big part as we move into 2025. I'm not sure if they're here this evening, but we have Emily Wolf, who works within community services. She's our evaluation manager. She will be helping in other capacities as well, along with Mika Delgado, who heads up the Healthy Youth Alliance and has offered to bring her expertise into the work that we're doing. You can see much of here, we've been focused on bringing together our different governance groups, our advisory board, our ops group, putting together and developing an actual plan for how we would go implement that vision, looking at a communications plan, and then also having the ability to do some service-focused work. So we've been working within the county and our county teams on crisis to really map out the relationships and intersections between each of the different teams. You'll hear from some of them this evening. We're also working on a project that really looks at what is the service landscape. So what exists out there, bringing more awareness around that, spotting the gaps, and also looking for the opportunities for where we can bring that alignment that the roadmap calls us to. At the same time, one of the challenges that we're up against is the workforce shortage when it comes to behavioral health. So Workforce Boulder County in July, they helped sponsor a workforce sector partnership that's regional across the Front Range. Our behavioral health planning team, so myself and Morrison, are participating with that group. And then we also, while all of this work is going on, right, we're getting all of our, like I call it, pulling our puzzle pieces together. There are existing aligned services, and I included just a few examples down here. These are examples from the division that I work in, strategic initiatives, but they are by no means comprehensive. for what is existing already within the system. But I wanted to point out that there are things that are happening and things that are being brought to our community to help us get there. And then looking to what's ahead as we move into 2025, we want to look at how do we increase that awareness for access. And it's things like this. It's bringing together people to make sure they know what already exists. We will continue to do quarterly convenings. We will have a news. We're looking at WellMind Connections website. Kelly and I and others are actually meeting on Monday to kick off a project to expand that, to really start to create that centralized resource of information. We also are going to be looking in this area at strengthening partnerships and the alignment that I talked about earlier. First in that is going to be prioritizing that implementation plan. So I'll share with you all, some of us in our advisory board and ops group looked at what we had laid out, and it was something like close to 70 projects. So it became very clear to us that we need to prioritize what happens first so that we can make this doable and actually make good progress. We'll be working through that, continuing to look at, like I said, that range of existing services within the continuum of care to find our opportunities where they exist. And then over here, we're going to look at how do we come up with something like an advocacy agenda that is shared across all of the different agencies and partners. And I'll give you an example. This is a topic within our advisory board. But imagine that we had a partner who has funding from the state, and that funding funds a critical service that would be devastating to our community if it were to be depleted or eliminated. We want the ability for all of the different entities to be able to stand up together and advocate. In that example, it's kind of reactionary, but we want to be able to be proactive too as we spot the opportunities coming down the road. And then lastly, I'll share with you, it's about laying the groundwork for sustainability. So each of the different programs you're going to hear from tonight have some element of funding that's either grant funding or term limited funding. And we need to look at how do we make our system sustainable. So that will be a key piece that we're working on in the upcoming year. And then lastly, as I mentioned, that huge engagement process that went on for something like 18 months with all of those different community members and partners, it really did center the community, and the community will continue to be the center of our work. So I'd like you to all just think about as we continue with that focus of centering community, what's one priority that you think we should keep in focus? And I'm going to pause there for just a minute to give you time to think about that and put your thoughts in the chat. If anyone has ideas off the top of your head too, you're welcome to go off mute and share as well. I'll give you a little bit more time to think about that. And you're welcome to share as we go on. We'll be capturing all of the questions and thoughts that are captured in the chat as we go through. So please, take your time to be able to think through that. But I wanted just to say thank you for listening to this update. If there are any questions that people would like to ask, now would be a great time. We could spend a couple of minutes on that. I want to make sure that we get to our key guests who have so much valuable information to share. But if anyone has questions, please feel free to raise your hand, speak up, or ask in the chat. And I see some really great comments coming through over there. Looking at how we empower our community leaders and neighbors, encouraging programs that increase the number of peer support specialists and people with lived experience. That's so important. And work that is happening, that is part of our plan. So thank you all. Continue to drop things in the chat. We are going to go ahead and move on to the highlight, which really is, this is we view this as a kickoff to the Spotlight series. So we want to do this quarterly, where we're bringing in different community partners to make sure that we inform our community members on how they can access the key services that already exist within our community. So we're going to kick that off with a presentation from Kate Parker. She's the Executive Vice President of Clinica Family Health and Wellness, and is where Mental Health Partners now lives. So Kate, I'm going to stop sharing and turn it over to you.
Thank you so much, and thank you all for having me. As Michelle shared, we Mental Health Partners recently merged with Clinica Family Health and Wellness. So you will start seeing that. I'm just trying to get my presentation up. So it's a slideshow. Okay. Do you all see the screen? Because I can't see when I'm on the screen.
We
Yes.
can see it.
Okay, awesome. And feel free to drop questions in the chat or come off mute if you have a question. But I came here today to talk about this merger and some services that we're offering and changes and challenges that we are going through. So this is just information about our various locations that we have currently. So we are in Boulder, Broomfield, Lafayette, Longmont, and also up in Ned. And all of these centers offer some similar services and some different services. One of the things I want to highlight is the 24/7 walk-in crisis center, and I'll be talking about a new location that we are getting. But most of these centers operate what is called a health home. And what that is a team-based approach to care. So folks can come in, they can get their case management, their medication, their therapy, that supportive counseling. What we find in a lot of the data and a lot of the things that we are seeing is people need a place and supportive network to help support their needs. And now with Clinica, we are in other locations. And so with the merger, we merged officially middle of October. So you will see on this slide, Ryan Wellness. We have been working with Clinica since 2013 in what's called an integrated health home. So we've already had Clinica based in that office for whole person health. And the goal is around physical, dental, and behavioral health all in one place. And then we moved into Netherlands together in a partnership. And so these other clinics that you see here that are legacy Clinica, we are not in those spaces right now, but they do have integrated behavioral health in those spaces. So they have what are called behavioral health professionals. So if someone comes in for a PCP visit, a wellness visit, and there's a behavioral health need, they are able to get treatment from a behavioral health professional. And they can also get like a brief therapy. And then we work in connection of how do we get them to more specialized services when they need those. This is a model just to show all the various services and programs, and there is a lot more than just what is in here, but by level of acuity. So we really start on the prevention end and we really try to get in there. And as Michelle was talking about, as funding has been getting cut, this the two ends of this grid here are the two ends that are getting hurt the most. So the prevention end and the crisis end. It's very costly and really hard to provide services on that crisis end. So you'll see ACT, walk in, and we have a couple new programs I'm going to talk about. And those are some of the challenges that we're facing. And so I am working with Michelle and Behavioral Health Roadmap and really need to work with the community around what does the community need and where do we want those dollars to go to. So we do a lot on the prevention end in hopes that we don't get to the crisis end of it. And then we have, when we say mild services or mild acuity, those are folks that are coming in for an episode of care for depression or anxiety or anything like that, where they can come in once a week or once every other week, have therapy. But for the most part, they're social determinants of health and their other needs. They don't have a lot of those needs, so we can serve them on a less intense basis. And then in the moderate scope, that's when we start getting into more intensity, more frequency of visits, more wraparound type services for our folks. So we have added some new services in the last couple of years, and some of this is based on feedback from you all. We have added urgent psychiatric care, which right now is located at Airport Road across from the jail, and that is offered 12 o'clock to 8 o'clock, and it does have a psychiatrist on staff. And so folks can go into there, and the idea is to divert from hospital care or higher level of care, and they can see a psychiatrist. We can put them on meds if they need medications. We can do brief therapy type services while they're waiting to get into services, and that is 7 days a week. That is a program, as Michelle mentioned, is grant funded, and the grant ends June 30th, 2025. So a lot of these new programs that Clinica Family Health and Wellness put together are funded through grants or contracts. Our funding is 45% Medicaid, and the rest is all through grants and contracts. And so for sustainability, we sign up for these, and then we work on sustaining these processes. Um, In-home respite is a new service. It is for all, and it is provided in what's called Region 6. So it includes Jefferson County and Gilpin and the mountain communities. It is designed for all, and the reason why I hesitate is some of the criteria for in-home respite. It's challenging to do it with an adult. You have to be willing to do it. So for the most part, the model is what we're seeing is really focused on adolescents or young adults that have family members that can be part of this and a system that can be part of it. So it's not just for one individual that's living in a home by themselves. They have to have a support system around that. And so that's why sometimes it gets challenging with adults. We have not gotten a lot of referrals for this service yet, and it is available. And so if adults want to come into those services, we will definitely see what we can do and how to figure that out because it is a new service. And then intensive family services is also another addition. And this is where our therapists, peers, case managers go into the home several times a week, provide services to the families. It could provide some respite services to this family as well. And this is focused on 18 and below. So this is a child service, again, hoping to get them away from going to the hospital or residential settings. And the new building, so we purchased a new building in Louisville also through a grant. And we were fortunate to be awarded that. And we are moving all of our acute services over to the Louisville building. We're hoping to open it in late spring. We are, if you've ever worked in construction, there's always challenges and delays with that. But what's going to live in that building is our walk-in crisis services, our withdrawal management services. We are opening up a substance residential service as well. And it also has our medication assistant treatment services that will be in there. And our medication assistant treatment services are throughout all those various locations that you saw. But we try to get people at the acute settings to get started on some of these meds so that they can get to recovery. This this screenshot is not great because it's super small, so people are probably like, I cannot see it. But the concept of it is taking all our various programs and how we serve people through the lifetime. So we serve people through the different various levels of acuity of what they need in their stages of behavioral health need. And then we also do this through a lifetime of care. So challenges, some of the challenges I spoke about that it's important for you all to know. Legacy MHP had over $3 million of cuts from county and state. This is happening throughout everywhere nationally. And Legacy Clinica also had financial strains. It did not impact their behavioral health services, and we're hoping it doesn't. The public health emergency unwind with Medicaid. A lot of people fell off Medicaid, and so they're uninsured, and it's getting harder and harder to serve those folks because there's not enough money or cushion to be able to provide that care. We were high on the hog with ARPA. ARPA gave us a lot of money and it was really great and invested in our workforce, and that is coming to an end. Some ARPA funding has already come to an end and some is coming. There are more providers. There's a larger network, and that is great. And there should be a larger network. And part of this behavioral health roadmap and what Michelle was talking about with the crisis services is looking at duplication and like where there's less money in that bucket. So where do we put those money in those services? And you all as the community and as the partner agencies and everybody just needs to drive. Where do these dollars need to go? Where's like the most immediate need? Because we do need to start prioritizing that when you have less money. Workforce, we're struggling significantly with workforce. We are what's called a safety net provider, and we can't compete with other nonprofits and private sectors when it comes to the financial support. So we're doing a lot of work with the state around workforce, and we're trying to do a lot of creative thinking. And with this merger, we're hoping that we have some opportunities also to improve the workforce. Um, the Behavioral Health Administration, which is our governing
Todo lo
body.
cual es
We're
el
working really closely with
gobierno
them,
en
but there's a
cuerpo.
lot.
Estamos
We
trabajando
have
muy
over
cerca.
1,000 rules and regulations that we have to follow. And it really creates barriers to access, and especially for this marginalized population. So if I can pay out of pocket or if I have private insurance, I don't have to jump through the same hoops that somebody that has Medicaid has to jump through or somebody who's uninsured. So those are some challenges that are facing some of our services. And we are getting to a point where we have to be looking at our services and what we are going to be providing, and where those needs are. And we will continue to advocate and continue to work with the state and get grant funding. But that is Clinica from a very high level, quick rundown. I'm not sure if there's any questions.
Hey, thank you so much for that. I think it's Eric has a hand up. Go ahead, Eric. We'll give Eric a minute. Looks like he might be having issues. You're on mute, Eric. Feel free to drop things in the chat too. But while we're figuring that out, does anyone else have questions for Kate while we have her here? I so appreciate you, Kate, sharing what's there, what's new, and then also the reality that our community, that you all in your agency and our community are facing around the funding piece and what's happening.
Um, Hi, just jumping in here, Wendy Schwartz from the City of Boulder. Hi, Kate. Thanks for your presentation. And I just was interested in returning to the slide that you had that I think the title might have been new programs, and it included like your psychiatric urgent care. Did I hear you correctly when you said that those are all grant funded, and that was it the case that they might not be continuing because of the grant funding?
It's a good question, and hi, Wendy. Urgent psychiatric care is grant funded and our intensive family services. In-home respite is through our crisis contracting with Signal. So we're safe with that one right now. The question with that one is utilization, and if more state dollars get cut, that could look different. But we've been working for the last 2 years with urgent psychiatric care and intensive family services to create a sustainable model for that. And I'm not worried about urgent psychiatric care because what actually is happening is it's taking some folks away from crisis. So there's a way that we can shift and move those parts and pieces. Intensive family services, I'm not sure where we're going to be with that come June. I mean, that's something that we're looking at, and also a lot of low referrals on that and utilization. Did that answer your question, Wendy?
That's really helpful. Thanks so much, Kate.
Yeah.
And then, Kate, there's a question in the chat about if there are any flyers available about those programs on the website.
There are. And our website will, right now, it's still, if you go to Mental Health Partners, www.mhpcolorado.org. If you go to our website, they are there. Our website is going to be merging with Clinica. We do not have a date yet, but all the programs are listed there. And if you ever want more information about any of these individual programs, you can reach out to me, and I'm more than willing to meet and talk about those various programs. There's different referral criteria, there's different issues with payer and who funds what programs, and that's why it gets challenging for folks to navigate the system. Yes, Aurora just asked. Yeah. See some things going in the chat, but I don't know if they're questions.
I see a hand up from Annette. I think we have time to take just maybe two more questions and then we'll move on. But if there's time at the end, we can answer more.
Hi, my name's Annette. I'm up here in Netherlands, and I just had a question about Clinica. And we've run into some cases where there isn't really an ability to help with eligibility for IDD, autism and brain injury through mental health partners. And I'm wondering if there's any plans to help work with other partners so that sites like us that are a little bit farther away from the central pieces can tackle that.
Yeah, it's a really good question, Annette. And there are times that we can serve IDD and brain injury. It really depends on their primary diagnosis and their symptoms, and also our scope of expertise. So we don't want to serve somebody that we don't have the expertise to serve. So we partner with Imagine, and I know that's a barrier because it's more down in the field with Boulder County. But it is something that we've been talking to Imagine about, but there's not a plan right now to bring that up to Netherlands, but I definitely will bring that forward.
Okay, so you're talking about Imagine the PASA,
Mm-hmm.
not A&I Avenues, because sometimes they need to go through now A&I Avenues to get the eligibility to use Imagine the PASA. I just wanted to say that if you need to partner with somebody up here, you can use the Peak to Peak Health and Human Services Alliance and get a hold of me at the food pantry. And we can also work with some transportation if there's an emergency crisis need for that too. But that's problem solving and beyond the scope of this meeting. Anyway, but thank you for your answer to that question.
Yeah, and thanks for the question. And we should probably connect offline.
Yeah, sure. Anytime. Yep. Okay, thanks.
Thanks, Annette. I think, part of what you shared just highlights the complexities that we were talking about too, right? So, Morrison, I'm going to look to you on questions that are out there.
Yeah, I think we have hands raised from Sylvia and then Nayla.
Yeah, I just had a quick clarifying question, I guess. On one of your slides, you had kind of like the different ages that you kind of serve, I guess. And was that more to illustrate that you serve people of all ages, or that you kind of have this more idea of like a continuity of care from this age to like, you know, when they're elderly or whatever? Because I have a friend of mine who gets some of her help through mental health partners and has for most of her life, but has kind of like come across different barriers in length of time for therapy and things like that, and had to seek that somewhere else. So I was just curious if you could touch on
No,
that briefly.
it's a really great question. We provide episodic care. And so those programs are to show that we're serving these various age groups. And it's really based on the needs, medical necessity, what needs to happen. So again, it goes back to jumping through some of these hoops and these rules and regs that we have to follow. So it's not like if I pay out of pocket, I could be in therapy for the rest of my life. We don't have that liberty to do that. And so that may be something that you're experiencing.
Thanks, Sylvia. And then Nayla, we'll take one more question if you'd like to go, and then we'll move on.
Sure. This is, I am more curious. I was part of the beginning of a team that we did focus groups and other things around what the community was asking for in terms of behavioral health. And it's not a secret that one of the barriers that we have is to offer these services in other languages, especially, well, in Spanish better. I am curious about if not any conversation, like it's a state level, about how we can, you know, be more flexible in terms of the professionals that we have here in the community, like people like me, for example. I am a psychologist from a different country, but I don't have a license here, and it's a barrier sometimes to offer my services. I don't know if it's any conversation around that, because like me, we have other people that we are able to do this work, but we don't have sometimes, you know, the bureaucracy of all these different licenses and things like that. It's difficult to offer. I mean, I am curious if it's any conversation about that.
There's, I'm in conversations with the state in a group around advocacy for creating other credentials, for lack of a better word, so that folks can be able to provide services and people can get paid for those services without having a license. So there's some universities that aren't accredited and therefore you can't get licensed, but that doesn't mean that person's not qualified. So there are those conversations going on. Not sure where it's going to go, but the state is listening and we're trying to figure out different ways, because that's been one of our barriers of hiring folks that are bilingual, bicultural, because their license or their degree isn't considered accredited, and therefore then they can't bill for services, and then we don't get any payment. And so it's just like this mixed bag.
Yeah. Well, I want to offer, if you need any help or advocacy in that terms, I will be happy to help.
Yes, we do. The answer is yes.
And I think your question is the perfect segue to hand over the presentation to the next team. So I would like to introduce Marnie Huffman Green, who is the ARPA Mental Health and Social Resilience Project Manager, and also works very closely helping to support the CAT team, Crisis Assistance and Treatment, also known as the CAT team with WellMind. So Marnie, I will hand it over to you to lead us into intros of your team and the presentation.
Sure. I first just want to say, Kate and Michelle and Tucker and Morrison, you have presented with such poise and calm. I am not feeling calm. To be really humble and transparent, this is such an incredible group of heart-centered, innovative, transformative, equity-centered folks in our community who have been doing this work for so long. So I feel very nervous. The breathing didn't help. So I come with such reverence, and I'm going to kick it off in a second to our two of our ARPA, American Rescue Plan Act, new initiatives, CAT and WellMind. And Nella, thank you for beautifully queuing up some of the themes CAT and WellMind will talk about in terms of bilingual, bicultural access. And Kathy Partridge, I want to give you a shout out because thank you, even though we didn't talk, for queuing me up around appropriate, accessible mental health services for the most vulnerable populations, including communities of color, LGBT community, and centering those. I just want to quickly update that in addition to CAT and WellMind, there are other ARPA projects that almost everyone here has been a part of, whether it was in community engagement or also receiving ARPA funds. As most folks here know, that there's some other ARPA buckets under equitable access, but really it's just how do we get folks the right service at the right time, and following a 2-year community engagement process that so many of you have shepherded. I just want to quickly update that in addition to sending grants to BVSD and St. Vrain, I think Katie McGee, I see some other BVSD reps. We've also given 9 other community-based grants under equitable access. And I want to just quickly read all the agencies because so many of our beautiful partners are here. So Amistad, Rise Against Suicide, Together, Out Boulder / Rocky Mountain Equality, LEAF, EFA, Our Center, Sister Carmen. And then also just a quick update that many folks probably know about, but one other important ARPA bucket was prioritizing mini mental health awareness trainings. So really destigmatizing trainings. And we've just also allocated 10 different agencies, separate from the 10 different agencies I just mentioned. Shout out, I see Avani here. So Natural Highs, Annette, I see you here, Peak to Peak, Penn Parent Engagement Network. I think some folks are here. Hope Coalition, My Emotion, La Luna Cultura, NAMI, I don't think I see Jack, and Boulder Mind. I'll make sure that when Michelle sends out the update, I'll send more information that highlights these other equitable access grants, but just wanted to really honor all the work that's been happening in the ARPA world. And with that, I hope I didn't talk too fast or my nerves didn't show. I want to pass it on to my amazing colleagues at CAT and WellMind, and also just want to acknowledge that as a new program, we humbly come to you to partner with all the amazing work all of you have been doing for so long, and really excited to be another resource to help increase accessibility and just let folks get the right treatment with heart-centered people that do whatever it takes. So Michelle, thank you so much, and I'll pass it along to our lovely CAT and WellMind teammates.
Thanks, Marn. I'm going to ask Jess to go ahead and queue up that first slide. And while she does that, I'll just introduce myself. Kelly Bai, I'm a program manager at Boulder County Community Services. I manage both the WellMind Connection Navigation Hub, but also know many of you, lots of familiar faces here tonight from the opioid abatement work that I manage and work so closely with Tucker around. So good to see you all. And so I'm gonna kind of kick us off and just kind of talk through a little bit of our background, our history as not just one program, but 2 programs that have since merged to provide comprehensive behavioral health support that spans both navigation and in-person assistance. And then kind of hand it over to the team to talk about exactly where we are today and what this integrated model looks like in our best hope for delivering services to the community. So with that, Jess, if you could go to the next slide. Thank you. So this is a little bit of background. Again, many of you are very familiar with this process. You have been involved from the very beginning. You have been the voices at the table saying that we need centralized navigation resources and teams, that we need bilingual and bicultural services, that we need more access to crisis supports or individuals from the community to support the community in that moment. And so this should be familiar to many of you, but to anyone who's totally new to this conversation, our our work largely began in 2019. And again, I want to honor that that's a number where the work formally started. Those conversations were going on for probably a decade prior. So many of you being involved in those conversations, just want to acknowledge that as well. But in 2019 was really kind of the beginning of this work in that Boulder County kind of commissioned some work with a consulting firm to say what's going on in our community. We've heard a lot of things about the barriers that are getting in the way to accessing behavioral health supports, and the confusion within the system. So we really want to know concretely what's happening and what to do about it. In 2020, that resulted in a set of recommendations. This will be familiar to everyone here, but of course, those recommendations were centralize your services. Stop making this so dang confusing. Stop playing into the matrix of fragmented care and instead bring it all together. So have a central navigation team that can support connectivity to all sorts of behavioral health resources as well as supportive resources that individuals are presenting with. And then also have some additional crisis services. That was also the impetus of our co-responder team, which kind of came out of that same report. Flash forward to 2022, the years in between were really kind of designed. So working with you all, community members, partner agencies, county partners to say, what does this look like? We have this broad vision of centralized navigation to behavioral health resources. We have this broad vision of mobile crisis support. But what does it actually mean? And so those 2 years were really set into designing the care elements, the scope of work. Where does it begin? Where does it end? Where does it supplement what's already happening in our community without creating any sort of duplication or redundancies in services. And then in 2023 is really when we launched. So we started with our navigation services first, and really started with a small pilot, taking our email and website, or excuse me, using our central email and website
utilizando nuestra página web y el
receive
email
service referrals or inquiries from community members. And then moving into 2024, we merged with the CAT team. So this is really the actualization of this one-stop shop vision that we are trying to pull together with the merger of our teams so that we take the guesswork out of this for community members. They don't have to worry or think about, am I in crisis? Am I not in crisis? We know that, folks don't necessarily align with that terminology all the time. And so let's take that guesswork out. Just know where to call, know where to access us as a whole team, and we'll take care of the rest and make sure that you're being served by the right team for your particular behavioral health need. Next slide. So what do WellMind Connection and CAT do? You can see on the left there, that's a visual directly from that report that I had mentioned, kind of coming forward as the foundation of what we're trying to achieve here. But to sort of translate it into high level points, really we're talking about increasing access through a coordinated single point of entry, or in our case, 3 distinct channels: a website, team emails, and our call center, which we'll talk about. Triage, make sure that all of our team members are cross-trained, and so that anybody who answers the phone or receives an email inquiry is able to assess individual needs, do basic care planning, and then hand off to the right level of care for that individual, whether it's resources or it's in-person support with a crisis assistance or crisis interventionist. And then in-person support, which I sort of just mentioned, the service and the in-person support being that anybody on our team is able to identify whether an individual would really be supported by additional in-person support, or if they really just need kind of a lower acuity, but connection to services out in the community and sustained connection to those services. Next slide. So who do we serve? Kind of everyone. So this is Boulder County residents of all ages, behavioral health resource navigation, I mentioned, as well as other supportive resources that are going to make individuals whole. And then again, in-person support, which our CAT team members are going to talk about more specifically. And again, a note that all services are free and offered in English and Spanish. So with that said, I'm going to kick it to Jess and Melissa to talk a little bit about our specific services that are offered.
Hi, I'm Melissa, and I am one of the bilingual crisis interventionalists from CAT. And we wanted to kind of let y'all know a little bit about the kind of services that we provide. As they mentioned, we are a mobile team. And we have offices in Boulder right now. But the services that we can provide are that we do have immediate support when it comes to de-escalation. For example, if people call right away, they kind of can get transferred to us, and we can do some of that immediate groundwork on the phone to get them to a place to where they can think more logically, and we can do an appropriate needs and safety assessment with them. Part of it is that risk assessment component, so that we can also kind of manage the acuity level of the calls. We do the safety planning, as I've mentioned, emotional support, do a lot of psychoeducation. And then we work with our WellMind navigators, and they're also our teammates, so that they can help us kind of not only identify those needs, but also explore what resources the individuals already have. And so that we can all kind of help and advocate to be able to coordinate services for them, get them a clear path and some steps forward. And that's kind of that last part where we also help connect them to behavioral health and other supportive resources, just to make sure to follow them through just a tiny bit. We don't do a lot of case management, but long-term case management. We will just do some of the short.
Yeah. So just to follow up a little bit about what Melissa was saying, because I know that in the moment we want to keep it sort of like a quick overview of everything, but even within those, I already switched, and I'm sorry, I switched to the next one, but even within those bubbles of like what the services are, we can break it down into a lot of like smaller components. So for example, when we offer things like emotional support, that can mean so many things to so many different people. We want to break away a little bit about like what may be perceived as crisis, and whereas that is a space that we do want to occupy, we also want to exist in all of the other mental health needs spaces that may not necessarily fall under this perceived category of crisis. So meaning if someone just needs that immediate emotional support where they can't necessarily access a therapist right away because they're on a wait list, or they do have a therapist, but they're not going to meet for another week, or even they just have a question about community services and they don't know who to call because they need to navigate the system, and navigating the system is complex. All of these plethora of situations are services that we can offer. And again, everything is in-house. So we have the navigation, we have the emotional response, like support, and we can help you figure that out. With that said, the few, I would say, limitations and exclusionary criteria, because we try to keep it as open as possible, all ages, Boulder County resident, whatever issue may come up, we can support with. The only limitations would be imminent danger to self and others. We highlight the word imminent just because we really do want to make that distinction, that if something is in the process of occurring that endangers lives, please call 911. We unfortunately do not have like that immediate capacity to respond as an emergency. We're more built into like an urgent type system. So for that type of response, that would be like one of our exclusions. If it's an emergency, call 911. Situations involving active violence or criminal activity, again, things that endanger people's life, just because we want to make sure that everyone is safe, that would be a 911 response. We wouldn't be able to get involved in any violent situation or criminal activity. Medical emergencies, severe substance intoxication or withdrawal that's happening in the moment. And again, it requires medical care, and minors without guardian consent. We would need to obviously obtain that guardian permission, but those are the only exclusionary criteria that we have.
Hi, my name is Naomi Siegel. I use she, her pronouns, and I supervise our WellMind Connection navigation team. And as you can see, this is our beautiful team. And 3 out of 4 are bilingual, native Spanish speakers from Mexico as well as from Ecuador. And all of these folks are really steeped in local resources and have previously worked at some local organizations that are on this call. So it's nice to introduce them. And next slide, we get to see the amazing CAT team, as well as half of their team, as actually 3 out of 5 are bilingual as well. native Spanish speakers and come from a variety of backgrounds that are super steeped as well in Boulder County and our community. And it's just amazing to get to work with these folks that really provide such outstanding supportive services, which we're going to get into a little bit more in depth.
Hello, everybody. My name is Jorge Gonzalez Soria, he, him pronouns, and I am one of the bilingual resource navigators with the WellMind connection team. A little bit about me, I have a history, a background working at SPAN, Safe House Progressive Alliance for Nonviolence, supporting domestic violence survivors with housing and resources. We supported with they had several housing programs there. So yeah, we did a lot of resource navigation and case management there. One thing I really like about this program that I've been working here for about a year is that I'm able to just focus on one thing. I'm just able to focus on resource navigation, and we do more of a light touch resource navigating. We don't do case management, but we're really able to yeah, focus a lot of our time researching and building connections and learning more about the new resources out there. So yeah, I'll be talking a little bit about what it is, what it looks like to work with us. Um, yeah, we like you see here in the screen, we can work with pretty much any situation. We don't have any exclusionary criteria. We can support finding a therapist that meets needs and any accommodations, one-on-one support. We can advocate for people seeking different types of resources. For example, I'm working with a client right now who is it's very housing related, and they've been homeless for a while now. And so I'm calling up different resources, different places, and advocating and just making sure that people are prioritizing this family. So yeah, that's something we can do. Legal resources. I primarily have worked with the immigration population in my background, so I can at least provide information on different types of legal routes and navigation around that as well. And we continue to learn. We're very passionate about the work that we do, so we're just constantly learning as we get in new situations. Every case is very different, so yeah, we're very passionate about continuing to learn and bettering ourselves so that we can be the best for our community. And we also don't want to show up as like, oh, we know it all type thing. We are yeah, we don't know everything, and we really value the wisdom and the expertise of the community partners that we're working with, and we're always seeking guidance. So yeah. Um, yeah, this is what you can expect to work with one of us. One-on-one personal support. We do follow-ups at least once a week until somebody gets connected to the service. Like we won't close the case until somebody is connected. We can support calling organizations. For example, like the case that I mentioned, somebody is really struggling, overwhelmed. This person is also neurodiverse, and so is really having a hard time organizing. And we're able to really accommodate that, help them call these organizations through a three-way call. We'll call the shelters, we'll call everybody that's on the list. And it's as much as we have the capacity to do, and we'll do it. We're strength-based, client-centered. We provide additional support researching the resources in the area, providing information about resources. So if for any reason, yeah, like we can't solve the housing crisis, but we can at least provide information about where does one start. And yeah, like I mentioned in the last slide, we take a holistic approach. And yeah, and how to use the WellMind connection for service navigation. Just contact us, let us know what type of support you're looking for. We'll be in touch with you either immediately. Somebody will answer if somebody's on the line, we can get started working with you and we'll gather all the information that we need. If for any reason, yeah, we're busy and we can't take the call right away, it usually doesn't like 24 hours, less than 24 hours before you hear back from us. Um, Usually we'll take about three attempts to connect. If we're not able to connect in that amount of time, then we'll close out the case. But usually we'll leave a voicemail, all the information that the person needs so that they can reach back out. And yeah, we don't ask for too much information. We mostly ask just for name, date of birth, language, and the services that are needed. And yeah, like I mentioned on the last slide, we provide that weekly follow-up until somebody gets connected with the resource.
Thank you, Jorge. So I'll do a quick just overview of how our in-person services work as well. And also, Melissa, feel free to jump in if I'm missing like any important information. But just to get an idea of the things that, again, how it functions and the things that we can offer. So it's non-emergency. We can do crisis intervention, triage and referrals, de-escalation, psychoeducation, phone support, in-person support. Really, this is just catering to the needs of whoever is calling. Meaning we can make an appointment if they need that. We can go see them right away. We can start over the phone if that's what they feel most comfortable and build that trust and then move to in person. We can do consultations. A lot of the times we've gotten calls for services that it's not necessarily for the person calling, but someone close to them and they don't know what to do with that. Providers have also called us with the same type of consultation needs. So there's a plethora of services that we can offer and also a variety of modalities that are all up to the community to decide in that moment what suits them best and what feels the most comfortable to them. So our goals are obviously to just offer community mental health support that feels like a peer-led support that doesn't feel like necessarily the typical responses that we've gotten so far, but something much more based on a human approach. Like we always say, kind of like if you went to your neighbor and you were like, I need some help right now, how can you support me? Reducing criminal justice involvement, trying to eliminate the barrier of just having to call 911, because sometimes there are so many reasons why different communities, like when you need that type of support, just picking up the phone and having to call 911 brings a certain level of even stigma with it that sometimes people do not want to reach out even though they need it. So even in that sense, this is something that we could break down for a while, but reducing that criminal justice involvement. Prioritizing prevention. This is where psychoed comes in, and we do a lot of that, just educating people on like skills training. Sometimes we meet with people several times just to give them that skill so that they don't have to have these reoccurring crises and get in the long term, find their way to a therapist or a long-term service. But prevention is a big one, decreasing hospitalizations. We want to do everything we can to prevent those holds. We know that sometimes that can backfire. That is not necessarily the best solution to the problem at hand. So this is also a big goal. And the last one is offer support to underserved and underrepresented communities and populations. And this is also why we've made such an effort to make most of our staff bicultural and bilingual to make sure that people can feel can see themselves reflected in the people that are supporting them, that they can access services that understand them culturally and linguistically, and that there's someone available that can always provide that service for them. Sorry, let me switch to the next one. I don't know if you want to take this one, Melissa, like some of the general examples.
Yes, some of our general examples for the type of calls that we can get are going to be some people are maybe having a panic attack and might be needing to kind of be walked through that. And so again, so that we can kind of get them de-escalated into a point to where we can do some more problem solving. Sometimes we have maybe someone who's having a depressive episode, and especially around the time of the holidays, things kind of spike up. They're not able to get their therapist in on time, or we need to get our navigators to assist us in getting therapy, and we might assist with some coping mechanisms during that time. Anything that's a nonviolent psychotic episode, that would be appropriate for us. Substance abuse urges, school. Oh, so sorry, my dog. Okay. School related issues, also to relationships, breakups, also to any kind of cultural or identity issues that they might be having within a family structure. Maybe they can't be communicating with their family about some of these issues that are a little bit more taboo in certain cultures than others. Anything from parental stresses, even to something like conflict resolution or neighborhood disputes. We all have the background to be able to assist appropriately in all those cases. So Jess?
Yeah, and these are just some examples. I really do want to highlight that. Just sometimes feel like their issue may not fall in I cannot call this number, or I need this site. I wouldn't be able to use this type of service right now. So again, not an exhaustive list, but just to get everyone thinking that there isn't a limitation into what you can call for, because it can fall under any of this and much more. And a little bit of a difference, again, there's some overlap into other crisis responses like co-responders. And what we do consider ourselves in a lower tier than them. So again, if it's an emergency, please always 911. If not, you can see how like in the middle, there's some examples or word that could be that overlap, but also the lower tier that also needs immediate emotional support. And sometimes they cannot access those services for a variety of reasons, and it doesn't necessarily fall into the 911 spectrum where you would need to call 911, but you also need support. So that's where we are.
So we can kind of skip this slide. We already talked about that. We just have one phone number. We want this to be as simple as possible to access the navigation team as well as the in-person support that's available. So this just shows how to contact us if you or someone you know needs that support. The first point is just both of our emails. So the WellMind connection email as well as CAT. We have our call center that is open Monday through Friday during regular business hours from 9 a.m. to 6 p.m. And then we also have our website, which there's an image of our website on the right side. And if you click on the Connect with Us link, you can self-refer that way and just fill out the form. It's super easy. Next. This is just briefly some data. This is navigation specific data since we've been open. So during the past 20 months, we've had more than 800 navigation cases that have been opened across 577 unique client households. And our number one most requested need is behavioral health support. So finding a therapist, finding substance use treatment, finding providers, finding a psychiatric assessment. So that's been our number one most requested need. And as you can see that almost 80% of those referrals are resolved. And then the reasons that they are not resolved are on the right side. So the most common reason is just unable to contact client when that follow-up is completed, as well as we've had a few that we found a service, but the client has denied those services. And then just real quick to ethnicity, it's been pretty even. So half of our clients identify as Hispanic or Latino, and then half identify as non-Hispanic, non-Latino. I could go into more data, but I know we're running out of time. So let me pass it to Jess.
Yeah, again, this is just a very quick snapshot. And since we just started taking calls in August, we've had a total of 95 calls. And these are some of the categories that those calls fall into. Just to give you all an example of the variety, and again, we're not even capturing everything here. You'll see that at the bottom. The other one is the one that's the highest percentage, because there is complexity and nuance to the things that people call for, that sometimes it starts with one thing and then we roll into another, and we try to do like that very comprehensive care in which allowing all of these issues to coexist and trying to tackle them alongside with our clients to be like, okay, how can we improve in all of these areas? So with that said, this is so far what we've seen, but again, it can be so much more than this. And yeah, we have a few stories. I don't know if we have time.
We're actually out of time, Jess. We're at time. We have 1 minute left. I thank you so much to Kat and WellMind for sharing what you shared. I will just quickly wrap up. If people have questions, please put them in the chat. We're happy to gather those and share back. I think most of them have been answered there. I'd like to share just a quick what's next, which is we will post the recording of this meeting on our website. Morrison will drop the link in the chat for you all. Likewise, if you would like to be added to our email list, because I know we have quite a few new people here today, Morrison will also put her email in the chat. You have my email address over there as well. So please feel free to reach out for any follow-up that you need or any other questions that you have. And then lastly, I just want to thank, first of all, our presenters and guest speakers for taking time and for everything that you shared. It's so heartening to see what the work that is happening in our community. I also want to thank our interpreters, so Paula and Angie, thank you. And for everyone who chose to spend their evening with us, for taking the time out. So thank you. We will reach out after the first of the year with plans for our next convening, which will be in March. Thank you, everyone.